We have 3 dementia gateways across the borough. We have the north, the south and central. These gateways are joint working along with the Dudley PCT, and we have in the one gateway we have 2 dementia specialist nurses, but those 2 nurses work across all the gateways. Nobody comes to the gateways unless they've got a diagnosis of dementia. What we do is we pick up the referrals, we gather all the information that we can on the person, and what we do is we then see if they need the dementia advisor to be involved. It could be that these people just need the support of the dementia advisors, going out to see them on a regular basis, putting them in contact with telecare and various other professional bodies that we have within the council, and just needing somebody on the end of a telephone. It could be that they've become socially isolated and they need somebody like the asset team to go out to them that might be able to support them out in the community. It could be that they're at the latter stages of the dementia and they need the support from the Dementia Gateways. It would be identified which gateway they would be best to go to, and they would be asked if they'd like to come along and have a look around. And if there was an interest, we would try, because we're offering a specialised individual service to those people, and we're offering a flexible service. We're asking them what they want from the service. We're not telling them what they're going to have. We're asking them what they want. So we're sort of seeing what activities they used to do, if they still do any activities, what their likes and their dislikes are, what they prefer to be called, and we're trying to identify there's a story of their life, so we can capture these and we can try and provide a service to them that's individual for those people. We have a national and local dementia strategy working with the council and health professionals, which works very well in Dudley. This involves dementia specialist nurses working from one of the gateways, which will receive referrals, and they will go out during the course of the day doing various assessments to diagnose people with dementia. We provide respite. This respite can be for the carer or a neighbour or whoever the person is that supports them, and they can then basically get time to themselves, which then recharges their batteries and makes them feel better, and they're more able to cope. And if we can support the carer in coping, then we're also supporting the person with dementia, and we're helping them to maintain their lives, to prevent them from going into residential care.
Well, basically the biggest help I think at the moment is Josie coming down to the Brett Young Centre. Twice a week now we managed to get that too. That does her good. She comes back from here very much more cheerful. She's had something to eat as well, which I haven't had to get. And I think that is excellent. You know, we're not doing too badly really. The doctors and that have been very helpful. We go around and see our GPs and they understand it. The telecare we are receiving is excellent. I think it was put in very quickly, and it gives me, I was surprised at the quality of it, for one thing, and the distance at which it will operate. It gives me peace of mind, myself. If anything happens to me or I collapse or anything, at the press of a button, I have got contact with somebody. Well, the Dudley Gateway is supporting me in excellent ways. Originally we came and we only had 1 day, but the last few weeks we've managed to get 2 days. That gives me an opportunity to do what I want to do, or not exactly that, but to get little jobs done that we're knowing full well that Josephine is safe under the umbrella of the Gateway.